As you may be aware, the New South Wales Government has made multiple changes to the public health orders that relate to the isolation requirements for people who are considered close contact, but at the same time work in critical industries. We've received multiple queries about how these isolation exemptions will affect employers and employees, especially as the lack of employees is putting a significant strain on many industries. My name's Andrew Kalita. I'm the Operations Manager of On Demand HR. And to help you to manage these changes, we're going to cover some of the most common questions we've received. So what does the public health order permit? Well, these new rules allow certain critical workers deemed to be close contacts to leave self-isolation in order to attend work as long as they have no symptoms of COVID-19. They will only be permitted to leave self-isolation if the employer determines that their absence from the workplace poses a high risk of disruption to the provision of critical services and they cannot work from home. Therefore, ultimately, it's up to the employer's discretion as to whether the employee will return to the workplace while they're still considered a close contact, and the employee is required to follow the employer's directive in this case. If a close contact does attend work under this order, they must wear a mask unless eating or drinking or for safety reasons, and they must undergo daily rapid antigen testing, with the result sent to the employer each day. If a worker tests positive to a rat, they must immediately self-isolate for 7 days. And if they begin to experience symptoms of COVID-19, they must also immediately isolate and may only return to work with evidence of a negative PCR test taken after the onset of symptoms. So which workers and industries does this order affect? Well, there's a number of industries, and for a full list, you can visit the New South Wales Health website, but some of the more common ones are agriculture, production and manufacturing of food, beverages, groceries, cleaning and sanitary products, transport, postal and warehousing, emergency services workers and healthcare workers, utility workers including energy, water and sanitation, information and telecommunications, social assistance and welfare services, and funeral, cremation and cemetery services. So how is a close contact defined? Well, the New South Wales Government recently overhauled the former definition of close contact and now describes a close contact as someone who lives in the same house as someone who tests positive or has spent 4 hours or longer with someone who tested positive for COVID-19 in a home or health or aged care environment, or they are determined one as per the New South Wales Health Department. Employees may not be aware of some of these new changes, so as an employer, you must ensure that the correct definition is being utilised if considering allowing a close contact back to the workplace. If you have any questions about these changes in the health orders or require any further assistance, we can arrange for a complimentary consultation, as well as a detailed strategic action plan that you can access by visiting ondemandhr.com.au/advice. So thanks very much for watching all the way to the end of this essential HR update, and we're very much looking forward to seeing you in the next one.